Welcome to Medical Student Life in Japan, a podcast created by a teacher and a group of medical students at Nara Medical University.
Our members are Yuriko, a third-year medical student, Gento, Taiga, Taika, Koichi, and Misaki, all second-year medical students, Yuka, a second-year nursing student, Suguru and Koshiro, both first medical students, and our teacher, Michael.
We are a small medical college in the Kansai region of Japan. This podcast has two great purposes.
One is to share stories about being a medical student here in Japan.
And also for our students to share fun ideas, opinions, and information about Japanese culture to people all over the world.
Thanks a
Thanks
lot
a lot for listening.
Welcome back to Medical Student Life in Japan. This will be part one of a two-part series and maybe some of our most special episodes so far. We had a listener, Brent, in Taiwan. Brent, thank you very much. He teaches there at a university, and he reached out to connect with us, and we've been emailing back and forth for the last few months, and luckily for us, Brent was able to connect our medical students at Nara Medical University with some medical students in Taiwan. And after going back and forth a little bit, we arranged some interviews, and in today's episode and in our next episode, we will share those interviews. This is probably the culmination of all the hard work the students have put in, and really the goal of this podcast from the beginning, to connect and communicate with people around the world. And I hope you really enjoy this episode. It was just amazing to hear students from two different countries and cultures sharing their ideas, having some fun, and I think it's going to be a really great listen for you. As always, thanks for listening to our podcast. Please share, like, and subscribe, and we really appreciate any feedback. You can contact us with the voice message through Anchor or leave us an email. We'd love to hear from you, and we'd love to grow the podcast so more people around the world can hear it and we can connect with you even more. Thank you so much.
Hello, Ian.
Hello.
Hello, nice to meet you.
Same here. Nice to meet you too.
Yeah, I'm Suguru Imanishi from the Japan's medical student. I want to know your name. Can you tell me? No? Yeah.
Well, my Chinese full name is Yang Chengda. So Yang is my last name, and Chengda is my name. It's my first name.
So yeah, I should call you Chang.
Yes. Go ahead and call me Chang or Yang. Like, I'm fine with both of them.
Okay. So I want to ask you something. First of all, what are you studying at the university?
So in my university, I'm a medical degree student, and I'm currently doing my final year, which is my 6th year.
Yeah. So maybe you are busy now, or?
Could you repeat the question? Maybe.
Yeah, you have so busy now for the.
It really depends. Yeah, I understand your question. It depends on the rotation itself. So, so for the past 2 weeks, I was in my emergency rotation, and it was busy because they have a very rich course. So we were assigned to the first district, and there's a second district, and there's a third district. So the third district was responsible for traumatic patients, and the first one is for the serious cases, and the second one is for those cases that are not so serious. So I really enjoyed it, and starting from today, this week, I am in rheumatology, which is where the pace is really like slower and you take time to wait for things to happen.
Oh, right.
So
Yeah.
I can be busy and I can be like not busy too.
Yeah. In Japan, also we have a 6 year to run basic medical knowledge, and after that we have 2 years to run clinical English skills.
Mm-hmm.
Yeah.
So here, it's separated as we have 4 years of basic medical knowledge courses, and then we have, and in the 5th and the 6th year we start to do rotations in the hospitals. We try to figure out what we learn and what it's like in the real world.
Yeah. Japan is the same as you. As your
Okay,
country.
great.
Yeah. I'm sorry. Can I ask another question? It will be a more complicated question. Is it okay?
Yeah, sure.
Yeah. Nowadays, COVID-19 is spread over the world. I heard that Taiwan is the most successful country in ending coronavirus with few deaths and few illnesses. So what do you think are the factors behind this?
Well, I wouldn't be so proud that we end the disease, to say that we end the disease, but I guess the success of us containing this disease from the beginning was the biggest factor. And also another factor was that our relation with China has always been kind of cold, and we're kind of excluded from the World Health Organization. So when we heard that there is information about a possible outbreak, we sent our delegation there. We sent an envoy, a delegation of investigation there before the news actually arrived to the WHO and to the world. So yeah, we acted quite early on, and also we had this SARS outbreak during 2003, and since then our government, SARS, it's another strain of coronavirus, and then that spread fast and
I got it.
killed a lot of people in Taiwan. So since then, our government gave a lot of power and voices to the Central Disease Control Center, Disease, the CDC. And basically, they're what they say is more powerful than the district government, the local government. So when we want to react, facing a disease, it's fast and united.
Thank you.
Complicated, right?
In Japan now, we all are wearing a mask. Yeah, so we can't stop the spread of coronavirus. Yeah, so I wanted to ask you some keys to end the coronavirus.
Oh,
yeah. Thank you so much. Yeah. I also want to ask you, what do you think are the good points, and if you are okay, the bad points with medical care in Taiwan?
Oh, it's an even more complicated question, but I'll try to answer it as with the best I can. So we have a universal healthcare system, which means that we basically it's obligatory like we require everybody to be in the insurance plan, and it is affordable. So if you've seen some news or Discovery channels, they actually made a series about how affordable our healthcare is in terms of the quality of the care to the money you spend. That's a good part for everybody who lives here. And the second good point of our healthcare is that it is very convenient and very accessible and very efficient too. It's but it still depends on where you live. So most of the resources are in the big cities. And there are a lot of like medical schools too for such a small place. So on the patient's end, I think they do have a good care. But if you want to talk about the system itself, we risk of running. We would possibly go bankrupt because it is really hard to raise taxes on the insurance. The insurance, how do you say, premium for every family, for every individual. You can't ask them for more money. And our doctors are sort of underpaid, even though it is still considered well paid in Taiwanese society. What's underneath was long working hours. And if you divided the hours if you divide it by the salary, if you divide the salary by the hours worked, it's not actually a lot. And another problem with our sorry. one more point. Another point is that our system is very specialized, that we do not have a good referral system based on the generalist care. So I would say that 95% of the doctors, they are specialized. And most of the clinics you see, the private clinics you see on the streets, they are all specialized doctors who don't stay in the hospitals, in the big research teaching hospitals anymore. They're the ones running the clinics. So there is no real generalist or referral system.
Right. Thank you so much. In Japan also there is a insurance system, and we are easy to access the hospital or treatment. And as you said, Japan has a problem. In the big city there are a lot of resources of medical care, but the rural area doesn't have the medical care. For example, our school is located in local area, so the doctors, we have only a few doctors, and patients, the number of patients are over the doctors. So the problem is similar to us, I think.
Is there a I don't know, here, in order to bring more people to work in the rural areas, they have like they provide a certain quota, certain number of students they enroll. Like they say to them that you don't have to pay that much, or it's free to go to medical school. But in return, you will have to promise that you will go somewhere far, somewhere rural, to work for several years, for a minimum of years after you graduate. That's how they try to solve the problem.
It is exactly what our school handles the problem. It is the same. Some people enter the university, and they give the money from the city or prefecture, and they decided to go to the rural area. Yeah, maybe this is the same system.
Well, hope there will be more doctors who work in the nature in the future.
Thank you. Yeah, answering my question.
You're welcome.
Yeah, I finished I finished what I want to ask you. Do you have any questions for me?
So, well, like, let's get rid of the big questions, but let's try like, what is being a student there like? I mean, what are the good things you like about medical schools, and what are the bad things you don't like or you hate about medical schools in Japan?
Yeah. The good point is a small community. We have our school has only medical students and nursing students, so we are strong connection between us, and we have a close relationship. So this can help in the future as we are doctors. This is a good point. Bad point. This is maybe the same as all other countries, but we are busy now. Yeah. But maybe this is the same all over the world. Yeah, but busy, so busy now. Yeah. But there is no other bad points, I think.
Oh, cool. Well, you're early on. I mean, I hope there's gonna be good points, more good points you find when you like gradually like move from one year to another.
Yeah.
And you said that you want to be a surgeon. Like, why?
Because I have a nature that I can't be still. I hate sitting on the chair. And I want to move always.
Want to move around.
Yeah. So I have to do the manual work. Yeah. And I also I want to prevent the disease, not curing the disease. In Japan, there are many doctors to cure disease, but there are few doctors to prevent disease. So I want to be a preventing doctor.
Okay, you want to be a preventive surgeon. Yeah. I've heard of that though. Well, we have the same problem here in Taiwan, that our medicine is quite focused on, like when there's a problem, we try to solve that problem, but we don't try to foresee the problem. And so I do think it's a good thing to have more doctors who believe in preventive medicine. Do you have more questions?
Okay. I learned that. This is a kind of big question, but I learned that Taiwanese people have a long health life expectancy and ranked high in the world happiness ranking. So what specific factors do you think are responsible for this?
You mean, what are the reasons why do we have a long life expectancy?
Yeah, and why the people think they are happy?
Oh, well, I wouldn't say that longer life expectancy means that happy life.
But ranked high in the world happiness ranking. I researched.
Oh yeah, we are. If you go on the street, like, it's packed with old people. Why? I don't know. I guess we are a rather safe country, and people care about trying to live as long as possible. So, and actually, when you get old and when you're retired, it is not common to go to older healthcare center for the elderlies, and you just send them there, and then they're more like, if you have a community with you, if you have a group of friends, usually go hiking still, even in your 60s, 70s. So I do think the habit of exercise and a good, like, you're still in the society, you're still going to places with people, that keeps you happy and that keeps you healthy. But yeah, I think that's probably why we have long life expectancy. Also, the basics, medical service is there for everybody. So it is very rare that you find an elderly that doesn't have care. Quite rare. They still exist, but quite rare.
Thank you. All right. Then finally, what kind of doctor you want to be?
Oh, do you want to take a guess? Like, 5 minutes of me smiling and everything. What kind of doctor do you think I was, or I can be? You know.
Yeah. You are always smiling. That's nice. Maybe pediatrics. Pediatrics.
It is on my list. I like when I was in my rotations, I really enjoy, like, not particularly with diseases with the kids, but just being able to see kids and play with them. And but on the top of my list is emergency department, and it's because of the it's shift work, so you basically clock in and clock out. I mean, I have a lot of side habits, like other habits that I want to keep doing. So I don't want my the time that I practice medicine takes over the time of my private life. And with emergency, you have a fixed working hours, so you can plan ahead what your life is going to be in the next month, for example. And the patients vary a lot, so you get to see a bit of everything, and I'm also interested in a bit of everything. So so far, I'm putting emergency on the top of my list, but maybe that could change. Who knows?
Yes. All right. Okay. I have finished my question.
Okay.
Do you have any or nothing?
So far so good. I mean,
yeah.
Okay, guys, that was a great conversation. Lots of interesting ideas about medical school in Japan and Taiwan. I think our audience is going to really enjoy hearing your answers. If you don't mind, Chang, can I jump in just with a couple more questions? What else interests you besides medicine? You said you have some hobbies or habits, or what kind of things do you like to do? Like, or someone who's in medical school, what are some popular things for Taiwanese students?
What I do is not quite popular. I'm into Argentinian tango as a dance.
Wow, interesting.
And yeah, that's what I've been doing since my second year of medical school. I chanced upon a school club, and yeah, that's what I need now.
At your university, there was a club?
Not actually at my university, but at another university. They have more club activities. So yeah, club activities are very common for medical students. Not just medical students, generally university students. And they love pop dance. There are guitar clubs.
Cool.
And in our medical department, we host events for the next, like, welcoming camp for the next year, next grader. So they usually would shoot a video, would have some events.
Right. Maybe some food, get some pizza or
exactly.
Some dinner or something.
To get the younger students know what it's like. And that's where our fun life and our dating life take place.
Right. Well, that's interesting you mentioned that, because Suguru, sadly, because of the pandemic, he's a first-year student. So club activities had kind of been canceled since last year. And now they're just opening again. Isn't that right, Suguru?
Yeah.
So maybe he's also, it sounds very similar. In our university, the older students have these welcome parties and try to advertise to the younger students. So Suguru, are you trying to join any clubs?
Yeah. I'm thinking archery club.
Archery club. Okay.
Yeah.
Archery? What? Oh, whoa.
Yeah. So I think in at least at our university, a lot of Japanese cultural clubs or Japanese sports. Yeah. So yeah, that's cool. Yeah. So Japanese archery, great. So that sounds similar. So club activities are a great way to socialize as a student. And besides the tango, Argentinian tango, what else do you like to do in Taiwan?
I do play the guitar. I mean,
oh, cool.
And besides that, I love learning languages. So
well, you're fantastic in English. May we ask how you became so good? Is that just been because you studied in Taiwan, or have you studied abroad?
Oh, before entering university, I spent around 8 months in Vancouver, Canada.
Oh, okay. Wow, that's great.
But I wouldn't say that's where my English got like the top. It's during the 3 years in high school. I happened to be in the class where the teacher really immersed us in English environment.
That's great.
So we've been watching a lot of series and reading a lot of opinions, like the opinion section from New York Times.
Oh, cool.
So yeah, that's why.
So besides English and I'm assuming Chinese, what other languages are you interested in that you study?
I'm also I speak also French, and I'm also studying Spanish for the moment.
Wow. That's great. Yeah. Well, that's great. All right. Well, let's go ahead and we're going to maybe start to finish up here, not to take too much of your time. But it was great meeting you, Chang. I'm Suguru. I'm sure he also really enjoyed it. And we really appreciate you taking the time. And hopefully we can keep in contact and maybe catch up with you at another time.
If there's a follow-up series, or you do want to do a follow-up on Taiwan's situation, feel welcome to contact me.
Yeah.
That's great.
Thank you so much.
Thank you very much. We really appreciate that. And it was really fun listening to you tell us about Taiwan. So thank you for joining us. And let's keep in touch, and maybe there'll be a follow-up down the road. And you can tell us more about your life in Taiwan. And if you ever make it to Japan, come and visit us.
Where are you guys located?
We're located in Nara. Nara, do you know the Kansai region near Osaka, the big city?
Yeah.
Have you been to Japan before?
I've been to Japan in 2015. I went to Yamaguchi.
Yamaguchi. Okay. Yeah. We're a little bit far from there, but Yamaguchi is the image of Yamaguchi is very, very countryside.
It is. I was so surprised. I was like, wow. But I like that vibe.
It's really nice. I've been there as well. It's really beautiful. In fact, Suguru was just talking in our previous episode about a place called Tottori, which is close to Yamaguchi, which is also really beautiful. Yeah, really nice place. So if you come back to Japan, contact us. We'd be happy to meet you. Hopefully when this pandemic thing
when it slows down, right?
Yeah, slows down.
Next year, yeah,
Hopefully
after I
next-
graduate.
Yeah, there you go. After you graduate, it's congratulations to you. Take a trip to Japan.
Okay.
Yeah.
I'll consider that.
Yeah. Okay, great.
That would
Well,
be
it's great talking with you, and we appreciate it. Suguru, any last words before we go?
Yeah. I'm sure Chang will be a nice doctor.
I think so
Oh,
too.
thank you so much.
I think so
I'm
too.
pretty sure you'll be a nice surgeon,
Yeah, thank you.
A preventative surgeon.
a preventative surgeon.
Yeah.
May that be a future specialism.
Yeah.
Especially.
Mm.
Yeah.
All right, Chang, it was great meeting you. Thanks again, and we'll hopefully talk to you again someday.
Okay.
All right. Thanks a
Well,
lot.
have a good evening.
Thank you.
Yeah, thank
Bye.
you.
Goodbye.